The passages of the respiratory system conduct air to the lungs. It is in the lungs that oxygen and carbon dioxide are exchanged. Diseases of the respiratory system hamper this function. The respiratory system can be divided into two major sections. The upper respiratory system is the nose, nasal cavity, pharynx, and sinuses. Basically, these are the passageways for air. The Eustachian tube links the pharynx to the middle ear and acts as a way for bacteria to get into the middle ear. The upper respiratory tract is rich with normal flora, all types of organisms, gram-positives, gram-negatives, aerobes, anaerobes, yeast, protozoa, you name it, it's there in the upper respiratory system. Some of the common genera are Haemophilus, which is a gram-negative bacillus, Veillonella, which is a gram-negative coccus, Staph aureus, and diphtheroids, which are common to the skin as well. All of the organisms that live in the upper respiratory system provide microbial antagonism. Should other organisms try to set up housekeeping there, there's really no room. The lower respiratory tract is the larynx, the bronchi, the lungs, which are composed of all of the little alveoli, the gas exchange areas of the lungs. This area is considered sterile. The larynx closes whenever you swallow, so material doesn't get past the larynx. Because there are also a number of phagocytic cells that roam through the lungs, they pretty much take care of anything that might accidentally get down there. In the upper respiratory tract, there are a number of diseases: streptococcal pharyngitis, scarlet fever or scarlatina, rheumatic fever, diphtheria, rhinosinusitis, otitis media, and the common cold. Streptococcal diseases are caused by Streptococcus pyogenes, which is a gram-positive coccus. This is also known as beta hemolytic strep or group A strep. Strep throat presents as a sore throat, fever, and malaise. It may spread lower and cause laryngitis and bronchitis. Scarlet fever occurs when the Streptococcus pyogenes carries a lysogenic phage that codes for a special toxin, a pyrogenic erythrogenic toxin. This causes a fever and rash that accompanies the other symptoms of strep throat. If strep throat goes untreated, there can be complications. One is glomerulonephritis. This is a type 3 hypersensitivity. You'll remember that when antigen-antibody complexes are not cleared from the body, they can get trapped in organs. In this case, this particular complex tends to get trapped in the glomerular filtration membrane, causing damage there. This used to be called Bright's disease. Sometimes the damage is permanent, usually it goes away. The other complication is rheumatic fever. Here the organism damages the heart valves. People who have had rheumatic fever are susceptible to endocarditis. Different strains of Streptococcus pyogenes will produce different virulence factors, which accounts for differences in the kinds of strep throat people get. Some people have a relatively mild disease, others may have a very sore throat and a very high fever. Streptococcus is spread through respiratory droplets. Most pharyngitis is really viral, but the bacterial pharyngitis will respond well to oral penicillin. Because we now have antibiotics, this has greatly reduced the incidence of both scarlet fever and rheumatic fever, as well as the glomerulonephritis. The best prevention is to avoid individuals with strep throat and then treat any diseases promptly so they don't develop into more complicated diseases. Studies have been done that show at the beginning of the school year about 5% of third graders carry Streptococcus pyogenes. By May, about 95% are carriers. So it is possible to have a carrier state of this organism, and healthy individuals could pass it on to others. Diphtheria is caused by Corynebacterium diphtheriae. This is a gram-positive bacillus that's really a pleomorphic bacillus. It's found pretty much everywhere in animals and humans. Most of the strains are not virulent. The virulent strain contains a lysogenic phage that codes for the diphtheria toxin. The diphtheria toxin causes the production of a pseudomembrane. This occurs on the back of the throat, and when it gets heavy, it will fall forward and block the airway, so it must constantly be removed. This pseudomembrane is dead cells and fibrin and other materials that kind of clump together into a mat of material. Diphtheria has pretty much been eradicated in industrialized countries by vaccination. There is an antitoxin that can be given to counteract the toxin. The Iditarod has a historical connection with the disease diphtheria. The children of Nome in the early 1900s had contracted diphtheria and desperately needed the antitoxin, but it was the middle of the winter. Planes weren't flying, trains couldn't get to Nome, Alaska. So they had the antitoxin delivered very close to Anchorage. From there, a group of dog sled runners, sort of by relay race, ran the antitoxin from near Anchorage all the way to Nome. The Iditarod continues to do this. The reason it's a race is because it was a life-saving race in this case. Humans are the only known host for diphtheria, and the best prevention is immunization. Rhinosinusitis is an inflammation of the nasal passages and the paranasal sinuses. We used to talk about rhinitis and sinusitis as though they were separate, but you usually have one with the other. Rhinosinusitis is more common in adults. Otitis media is an inflammation of the middle ear. Here the bacteria from the pharynx can travel along the eustachian tube and set up housekeeping in the middle ear. This is more common in children. Their eustachian tube tends to be a little flatter and it's easier for bacteria to travel to the middle ear. Because pus and fluid may build up in the middle ear, there can be enough pressure to actually rupture the tympanum. Usually these are caused by normal bacterial flora. Streptococcus pneumoniae, Haemolysis influenza, and Moraxella catarrhalis are the most common causes. Most of the inflammations are viral, however. You can treat bacterial infections with antibiotics. The viral infections simply need to run their course. There are immunizations against influenza and strep pneumoniae, and these may help prevent otitis media. Since the causative agents of these conditions are normal flora, usually they're contained by the immune system. The common cold is caused by numerous viruses. At least 200 different viruses are known to cause the common cold. Adults average about 2 colds a year. Sneezing, rhinorrhea, which is a fancy name for runny nose, and congestion are the most common symptoms. A fever is rare with a common cold unless there is a secondary bacterial infection. This is extremely infective. One virus can cause the disease. It's easily transmitted between people via fomites. Most people self-infect. They touch something that someone else has touched and then they rub their eyes or their nose. Hand washing is absolutely the best prevention for the common cold. In the lower respiratory tract, the infections include bacterial pneumonias, Legionnaires disease, tuberculosis, pertussis or whooping cough, inhalation anthrax, influenza, some coronavirus respiratory syndromes, respiratory syncytial virus infection, Hanta virus pulmonary syndrome, and a couple of miscellaneous viral respiratory diseases. Pneumonia is an inflammation of the lungs in which the alveoli and bronchioles become filled with fluid. If they're filled with fluid, you can't put air in them, so you can't exchange oxygen across them very well. If the fluid is pus, then it's referred to as empyema. Sometimes the inflammation will also irritate the pleura, the covering around the lungs. Then you have a condition known as pleurisy. Lobar pneumonia is when an entire lobe of the lung is involved. There are a number of organisms that cause the various pneumonias. Streptococcus pneumoniae, which is a gram-positive coccus, sometimes known as pneumococcus, is the causative agent for pneumococcal pneumonia. This organism is normal flora in about 75% of the population. The virulent strains have a capsule, and that's what helps them with their virulence. This is the most common cause of community-acquired pneumonia. Now, a community-acquired disease is something that you get from being in the community rather than being in a healthcare facility. With pneumococcal pneumonia, there is labored breathing, fever, chills, and congestion. Pneumococcal pneumonia is usually a secondary kind of disease. The pneumococcus is inhaled into lungs that are already damaged by something else, maybe influenza. Pneumococcus is responsible for 85% of all cases of bacterial pneumonia and 30% of nosocomial pneumonia. The usual suspects are most likely to get pneumococcal pneumonia: those that are very young, those that are very old, people who abuse alcohol and drugs, diabetics and other people with chronic conditions, and of course individuals who have AIDS. Pneumococcus responds very well to antimicrobials, particularly penicillin. For the immunocompromised population, there is a vaccine available. Another pneumonia is primary atypical pneumonia, or mycoplasma pneumonia. This is caused by Mycoplasma pneumoniae. Since this organism lacks a cell wall, there is no gram stain. This is the leading pneumonia in older children and young adults, a population you don't usually think of as having pneumonia. This is what's sometimes called walking pneumonia. Usually the disease is mild and it may follow another respiratory infection. Someone will have had a mild cold, they'll think they're over it, then they will start coughing, maybe have a little bit of a fever, and if they see a physician, the physician will confirm that they actually do have a pneumonia. This is spread through respiratory secretions and close contact. However, there is some evidence that mycoplasma may be normal throat flora. It's easily treated with antimicrobials, particularly erythromycin and doxycycline. Prevention is difficult. Patients are often infected for long periods of times, so it's hard to tell when someone may be shedding the organism and when someone may not. Hand washing, avoiding fomites, and reducing aerosols are all important means to help prevent this infection. Klebsiella pneumonia is caused by Klebsiella pneumoniae. This is a gram-negative bacillus. This organism has a prominent capsule. Some of you have had this one as an unknown in lab. This is that one that's really slimy on the plate. Gram-negative bacteria are a leading cause of nosocomial infections, and gram-negative pneumonias are among the leading cause of nosocomial death. This is an opportunistic infection. This organism will actually kill the alveolar cells and often invades the bloodstream. Because this is a gram-negative bacillus, we have endotoxins that can then be in the bloodstream. Alcoholics, immunocompromised, and here we're talking old and young as well as other immunocompromised individuals, and people with AIDS are the most likely victims. These people are going to have a poor ability to clear aspirated oral secretions. We see Klebsiella pneumoniae a lot in people who are laying in bed for long periods of time because that sort of allows the secretions to trickle down the back of the throat easier. Supportive care, rest, antipyretics and antimicrobials are the method of treatment. Prevention, good aseptic technique when you're dealing with people who are bedridden. Also, getting people to sit up during part of the day so that they can really clear out their respiratory secretions is very helpful. There are some other bacterial pneumonias. Haemolysis influenza is a gram-negative bacillus. It's normal throat flora and it's opportunistic. Usually we see this after someone is getting over something else. Staphylococcus aureus is a gram-positive coccus. This will cause a multifocal pneumonia. That is, when they look at the chest x-rays, there are several spots where there are infection. This particular type of pneumonia can be rapidly fatal. We've talked about pneumonic plague caused by Yersinia pestis. This is when the organism gets into the lungs and can then be spread by respiratory droplets. And the chlamydias are intracellular parasites. This means they don't live very long outside of their host. These are gram-negative bacilli. Chlamydophilus psittaci causes ornithosis. This is also known as parrot fever. Birds are actually the reservoir for this organism, and people who are too close to their birds sometimes get this particular type of pneumonia. Chlamydophila pneumoniae is the other cause of chlamydial pneumonia. Both of these are relatively mild diseases that can be treated with antibiotics. Legionnaires disease got its name because it was first seen in 1976, the country's 200th birthday. It's caused by Legionella pneumophila, a gram-negative pleomorphic bacillus that's very fastidious, which means it's hard to grow, and it's an intracellular parasite of macrophages, meaning it can be ingested but then doesn't get killed. This organism is found in most water in the environment. It withstands heat and chlorination, and it's typically spread through aerosols of contaminated water. In 1976, the water on the roof of the hotel had the organism in it, and the air conditioning intake vents were taking in aerosols of this water and spreading it through the hotel. The disease is most severe in people who smoke and in older men. It can be treated with antimicrobials. Quinolones and azithromycin are particularly good against it. The prevention is to avoid environmental water aerosols. Tuberculosis is caused by Mycobacterium tuberculosis. While this is a gram-positive bacillus, because of the mycolic acid in the cell wall, it does not gram stain well, so it's better known for being an acid-fast bacillus. This is a leading disease killer worldwide, but it's much less of a problem in industrialized countries. This is spread through the air. This organism is very small and can last for a long time in the environment. That mycolic acid really protects it. The organism is inhaled, so it enters the lungs. The mycolic acid means that it takes a long time for the cell to divide, so it has a very long generation time. It also protects the cells from lysis by the phagocytes. So it gets ingested and then it lives inside the cells. It's actually capable of growing inside of phagocytic cells. And it's resistant to most antimicrobials and disinfectants. Usually, individuals with a normal immune system wall off the infected phagocytes. The organism can remain dormant in these macrophages for years. If the individual then becomes immunosuppressed for some reason, and this could be by age, or they have surgery, or they have some disease, this can allow for the organism to be reactivated. Treatment is months with several different drugs. Isoniazid and rifampin are very commonly used along with a number of other drugs. Multiply drug-resistant tuberculosis is very hard to treat. We believe that this organism has developed because of non-compliant patients, patients who didn't take all of their drugs for as long as they were supposed to take them. We now also have something that's called extremely drug-resistant tuberculosis. This is resistant to almost everything. The good news is new drugs are being developed, and these are being used to treat the multiply drug-resistant and the extremely drug-resistant tuberculosis. Because these organisms developed as a result of non-compliant patients, directly observed treatment short courses are recommended. Here, patients are observed taking their medications to make sure that they take all of them and for the prescribed time. Pertussis, or whooping cough, is caused by Bordetella pertussis. This is a gram-negative coccobacillus, again very fastidious, so very challenging to grow. Pertussis usually starts out as a mild cold. After 1 to 2 weeks, the severe coughing begins. Vomiting, diarrhea, and choking can occur, and there's limited oxygen exchange. The individual tends to turn blue, they become cyanotic. They cough so hard and for so long they don't inhale, so after several minutes of coughing out, they stop for an inhale, and that inhale is what gives the whooping sound that gives the disease its name. This is spread through respiratory droplets. The good news is it does not live long outside of the body, so it takes fairly close contact. There are 4 phases: incubation, catarrhal, where they're coughing, paroxysmal, where they have the really deep coughs, and then convalescent. Treatment is primarily supportive treatment. The vaccine is the best prevention. We are seeing a reemergence of this disease because of failure of people to be immunized. Inhalation anthrax is caused by Bacillus anthracis, an aerobic, endospore-forming gram-positive bacillus. You'll remember that all of the bacillus are very common in the environment, and that anthrax is a zoonosis found primarily in sheep. Here you inhale the endospores and they germinate in the lung. Again, it's not the bacteria, but the toxin they produce. This organism produces a cytotoxin which damages lung tissue. And of course, the lung tissue can't repair. What you get is scar tissue back. About 10 years ago, anthrax was weaponized. What they did was they genetically engineered the organism to make smaller endospores. This would mean that more endospores would be inhaled more deeply into the lungs so that there would be a bigger dose and more damage done to the lungs. Many die with anthrax, even with supportive therapy and antibiotics, because the toxin damages the lung tissue and the lung tissue can't repair fast enough. They literally run out of enough gas exchanging tissue. A vaccine is available for the military. Researchers may also use it, as can animal handlers. It's 6 shots over 18 months with annual boosters. Influenza is caused by the influenza virus, which is an RNA virus. This virus has protein spikes on its capsid. The proteins are hemagglutinin and neuraminidase. The spikes are involved in attachment of the virus, and the virus will attach only to lung tissue. Each year, the virus undergoes something called antigenic drift. There are small changes in the RNA that lead to small changes in the protein spikes. About every 10 years, the virus experiences antigenic shift. Here we see a major change in the viral RNA. Antigenic shift occurs because birds, pigs, and humans can all share the influenza viruses. If more than one type of virus infects the same organism, the RNA may recombine and a new virus emerges. Two viruses infecting the same organism will mean that within the same cell you will have two different viruses replicating. As the viruses start to put themselves together, we get major changes in the RNA. This is antigenic shift. Antigenic shift has been responsible for major pandemics. One of the worst influenza pandemics was the one in 1918-1919. This was right at the beginning of World War I. More people died as a result of influenza worldwide than died in World War I. There are two types of influenza viruses, type A and type B. The type A virus experiences antigenic shift, but the type B does not. When an influenza virus is found, it is named by its type, either A or B, the location where it is first isolated, the date of the original identification, and the type of antigens, the H antigens and the N antigens. So a virus named A Singapore 180H1N2 would be a virus that's a type A virus. It was first isolated in Singapore in January of 1980. Its hemagglutinin is type 1 and its neuraminidase is type 2. Epidemiologists are particularly concerned about type A viruses that infect birds. These have antigens that are similar to those viruses that caused the pandemics of 1918, 1957, and 1968. These viruses were H5N1 type viruses. The reason epidemiologists are so concerned about this particular virus is this virus targets young adults. Most influenza kills the young and the old. This one kills young, healthy adults. Influenza has the same symptoms as a cold, but with a fever. You're contagious one day before you have symptoms, and you continue to be contagious 1 week after symptoms disappear. There is a high mortality rate in the old, the young, the pregnant, and anyone who is chronically ill. Usually, secondary infections are the cause of death. The best prevention for influenza is vaccination with a multivalent vaccine. They inject you with several strains of the virus, the one from last year as well as the one that's most prevalent all the time. Vaccinations are about 70% effective. There is a nasal spray that's available for people who are aged 2 through 49, and hand washing is still the best way to prevent the transmission of the virus. Treatment is supportive. You can only treat the symptoms. There are some antivirals, but they have to be taken within 48 hours of infection, which means you've got to get them the first day you have symptoms. You do need a prescription to get them. You may take oseltamivir pills or inhaled zanamivir mist. Amantadine and rimantadine used to be given, but it's being discouraged to give those because the virus seems to have developed a resistance to these drugs. The coronavirus is an RNA virus. It is one of the group of viruses that causes the common cold. The disease it causes is usually mild, but there are two emerging diseases that are coronavirus-based. In 2003, we saw severe acute respiratory syndrome, or SARS. Then in 2013, we saw Middle East respiratory syndrome, or MERS. With these syndromes, there's a high fever, shortness of breath, dyspnea, malaise, and body aches. After a week, there's a dry cough and usually pneumonia. SARS had a 10% mortality rate. MERS has so far had a 50% mortality rate. The virus enters the body through respiratory droplets. It destroys lung cells and then spreads via the blood to the heart and the kidneys. Both of these spread at an alarming rate. They quickly became pandemic. SARS seems to have abated, but MERS is new. What's interesting is camels seem to be the reservoir for this particular coronavirus. It's diagnosed based on the signs and symptoms, and it's treated with supportive treatment. Recombinant DNA vaccines to SARS are being tested for efficacy and safety. Ultimately, both of these diseases were brought under control by old-school techniques. They isolated and quarantined the sick until we had no more cases of the disease. Respiratory syncytial virus is a paramyxovirus that's an RNA virus. This one does not last long outside the body. RSV infection is the most common childhood respiratory disease, particularly in newborns and young children. Annually, there are community-wide outbreaks. Viruses tend to show up in the fall, winter, and early spring because that's when people are crowded together in spaces and don't get a lot of fresh air. And this is true of respiratory syncytial virus. The disease presents with rhinorrhea, fever, cyanosis, and coughing. Sometimes there may be a little wheezing, so sometimes it's mistaken for whooping cough, but the wheezing is usually relatively mild. This is the leading cause of bronchiolitis and pneumonia in children that are under a year in age, and it's the leading respiratory killer in infants. In older children and adults, respiratory syncytial virus causes a very mild head cold. Some children develop tracheobronchitis. This is known as the croup. This virus causes the cells to merge. That's called a syncytium. You have mucus, fibrin, and dead cells. This tends to block the bronchioles. It spreads during close contact with an infected person. Usually the person has to touch the other person or they have to handle recently touched fomites. This virus does not last long outside of the body. Prompt diagnosis is required in infants. Older children and adults have a relatively mild disease and typically don't need any treatment. Infants, however, will need oxygen therapy, antipyretics, IV support, and may need antimicrobials if they get secondary infections. Control is good aseptic technique with infants and hand washing. A lot of older children can bring this virus home to their new baby brothers or sisters. Hanta pulmonary syndrome is caused by the Hanta virus. This is an RNA virus that infects mice, particularly deer mice. Humans encounter the deer mice and they inhale either dried urine, feces, or saliva. This is not a disease that is spread person to person. The virus enters the bloodstream and infects the blood vessels, particularly the blood vessels in the lungs. About 50% of the people who acquire hantavirus die of pneumonia and vascular shock. Fever, fatigue, and muscle aches, particularly of the large muscles in the thighs, hips, and back, are hallmark of this disease. When this disease was first described, it was seen in Four Corners, New Mexico. There is a large population of Native Americans here, as well as a population of people whose ancestors came from Europe. Native Americans have a much weaker immune system than people who have that connection back to Europe. If you have ancestors that lived through the bubonic plague and smallpox and several other things, you have selected a fairly strong immune system. Native Americans have never experienced that. When the hantavirus was first seen, Native Americans were the ones that were the sickest and most likely to die because of their immune system. The treatment for this disease is supportive care. The prevention is to avoid close contact with deer mice. There are a couple of other respiratory viruses. These tend to cause respiratory illnesses in the usual suspects, children, elderly, and the immunosuppressed. Cytomegalovirus is one. It can cause a respiratory illness. The metapneumovirus and the parainfluenza viruses are both RNA viruses. The metapneumovirus is second only to the rhinoviruses as the cause of the common cold. Now, they actually found this virus using DNA and RNA probes, and they've made this statement about how common it is based on finding antibodies in individuals. There are so many people with antibodies to this that they feel that it must be a very common cause of the common cold. The parainfluenza virus can cause croup and viral pneumonia in young children. This is also the virus that causes summer flu. People will think they have the flu, but it's the middle of the summer. The influenza virus, the true flu virus, is only active during the winter months. If you have influenza or influenza-like symptoms in the summer, you probably have parainfluenza. These viruses are all spread through respiratory droplets, and hand washing is the best prevention. All of them are treated with supportive treatment. There are just a handful of fungus that can cause respiratory diseases, and most of these fungus use the respiratory system as a way to enter the body. Some of them will then get into the bloodstream and travel to other organ systems. For the most part, fungus don't like to grow at body temperature, which is why there are so few funguses that cause respiratory or systemic disease. All of these fungi are endemic to specific regions, so you pretty much have to live in or visit one of these regions to have one of these mycoses. For people who live there, the disease is usually mild and self-limiting. You don't even know you have it most of the time. However, if someone is immunocompromised, you'll have a more pronounced disease, and sometimes people who travel in the area pick up the disease and have something more significant. It may spread from the lungs to other organs, which is why these are called systemic. Coccidiomycosis is caused by Coccidioides immitis. This is endemic to the southwest. The disease is sometimes called San Joaquin Valley fever. You inhale the spores, and the spores are found in the dust. Blastomycosis is caused by Blastomyces dermatitidis. This is found pretty much in the southeast United States all the way from the Gulf Coast up into Canada. Here again you inhale the spores in dust, but these spores tend to reside in forests and abandoned buildings. Histoplasmosis is caused by Histoplasma capsulatum. This is endemic to the Ohio River Valley. Here you inhale the spores that tend to be found in bat guano or bird droppings. Treatment for all of the disease is supportive. If the disease is severe enough, antifungals may be given. Pneumocystis pneumonia, sometimes referred to as PCP, is caused by Pneumocystis jirovecii. This is a fungus. Now, at one time, this organism was called Pneumocystis carnii, and so the PCP stands for Pneumocystis carnii pneumonia. Doesn't really fit anymore. We also thought Pneumocystis carnii was a protozoan, but now we know the disease is caused by a fungus. Pneumocystis pneumonia is an AIDS marker disease. There is increasing difficulty with breathing, there may be a mild anemia, and hypoxia occurs. If this is left untreated, more and more lung tissue becomes damaged and death occurs because there's simply not enough lung tissue left to exchange oxygen. In normal people, this is asymptomatic. You never know you have it. If you've been exposed to it, you do have a lasting immunity to it. The organism cannot survive long in the environment. It's transmitted through droplet nuclei, so you have to inhale something that's fairly recently been coughed out. It can be treated with antimicrobials, not antifungals. Trimethoprim and sulfamethoxazole are the drugs of choice. This only infects the immunocompromised, so the best prevention is stay healthy. Don't become immunocompromised.